Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. Let's talk about the VA staffing issues and what is being done about it. There's been a lot of conversation around the elimination of 10,000 or more employees through attrition, they say. In the meantime, there's this big effort to pull in more veterans into the VA's system. So it seems very awkward to have a strategy like that. So let's see. Here we have a headline, and it states that Tester, who is the chair of the Senate Veterans Affairs Committee, says Tester demands Biden administration reverse course with unjustifiable staffing strategy at VA Montana. Now, I will tell you that it's not just a staffing issue in Montana. It's the focus for Senator Tester is Montana because that's the state he's a senator for. But the VA's staffing strategy nationally is an issue, and I'm sure we're going to see some of that trickle in here. Please hit the subscribe button, share, all that good stuff. Hit the like button, all that. I really appreciate it, and let's jump into it. There's a sub-headline here. It says, Senator to VA. This decision to cut critical mental health positions at VA Montana is unjustifiable and unacceptable, especially in a state that ranked third highest in the rate of deaths by suicide among veterans of any state in the nation. Monday, June 17th, 2024 is the date that this came out, and let's jump further into it. Continuing his oversight efforts of the Department of Veterans Affairs, Senator Jon Tester, chairman of the Senate Veterans Affairs Committee, today called on the Biden administration to take immediate action to protect Montana veterans' access to health care and mental health care by reversing its decision to cut staffing at VA Montana. Now, as we go a little bit further, think about the national impact and really the overall message that the VA needs to pay closer attention to the collateral damage of eliminating staff. There is a quotation here, and it says, I write to express my concerns that the Department of Veterans Affairs Health Administration recently announced staffing reductions will hit hardest in rural areas like Montana and call on you and the department to reverse them. Tester wrote in a letter to VA Undersecretary for Health Dr. Shereef Elnahal, the department's top healthcare official that is tasked with overseeing VHA. Remember, the VA is a three-headed monster. You have VHA, the Health Administration, VBA, the Benefits Administration, and the National Cemeteries Administration. So, moving on. Any effort to reduce hiring for high-demand mental health positions, especially those in rural areas, could have dire consequences on Montana veterans' access to health care and benefits. VA needs to focus on hiring more mental health care providers in rural America, not less. Earlier this year, VA announced it would cut staffing across VHA nationwide. Right? So here we are, nationwide. Tester has repeatedly raised red flags about the impact this hiring strategy could have on veterans in Montana and rural America. Here's the thing. Contact your senator. Contact your congressional member. Let them know that you have an issue with this. Moving on, Tester has repeatedly raised these red flags. The letter comes on the heels of VA Montana indicating that mental health employees are among positions proposed to be cut, despite prior assurances from VA leaders to Congress affirming mental health hiring would be exempt from their new staffing strategy. Tester highlighted this move is contrary to guarantees VA made Congress, writing, earlier this year, Department made assurances to Congress that any new staffing strategies would include continuing to hire mental health care providers, especially in rural areas. However, this is evidently not the case, as more than 10% of the positions proposed to be cut just at VA Montana were providers or support staff directly related to mental health care. Tester continued citing his concerns. Mental health is one of the biggest issues facing my state, and particularly our veterans. This decision to cut critical mental health positions at VA Montana is unjustifiable and unacceptable, especially in a state that ranked third highest in the rate of deaths by suicide among veterans of any state in the nation. I urge you to prioritize the unique challenges of veterans and providers in rural America as you reevaluate VHA's staffing strategy, and to not needlessly reduce access to care for veterans in rural America. Underscoring the importance of delivering for Montana veterans by ensuring the department has the staff in place to serve them, Tester concluded veterans earned and deserved the best and most timely care regardless of where they live. Doing right by rural veterans requires VA to have the staff in place to serve each and every one of them in every corner of the state. A lot of work remains to honor the promises to these folks, and I will continue holding the department accountable to honor those promises. As chairman of the Senate Veterans Affairs Committee, Tester has been leading the charge in Congress to hold VA accountable to ensure it has the staff in place to best serve veterans and make sure department continues to hire mental health providers, especially in Montana and rural areas afflicted by higher suicide rates. In April, Tester sent a letter to the VA Secretary pressing the VA to improve rural veterans' mental health care by continuing to hire mental health providers. Tester sent an additional letter in April to the VA Secretary pressing for more information on the department's hiring plan and expressing his frustration with conflicting communications Congress and VA employees and the leaders in the field receive about potential cuts and hiring limitations. In May, Tester questioned the Secretary again on VA's decision to cut staff at VHA despite recent increases in veteran health care enrollment and eligibility, which has been my whole thing this whole time. How can you be pulling more veterans into the fold? They're getting enrolled into health care, and then you're going to cut health care. It makes zero sense. At a hearing on the VA's budget request that was asked of the VA Secretary. He also raised alarms about the VA mental health care hiring at the rural veterans hearing, where he pressed VA officials to ensure VA continues to hire mental health providers in rural areas amid VA's decision to reduce staff. So, again, it's a horrific situation. My whole thing here is you need to be aware that VHA nationally is reducing. You need to reach out to your senator, your congressional members, let them know that you are opposed to that. What are we going to do? We're going to sit by and wait for our VA facilities to be skeleton crews more so than they already are. Calling in and having 30-day waits is not acceptable. So reach out to your congressional members. Let them know. Do it by phone. Do it in person. Do it by email. You can do any of those things reaching out. Their websites, you can find them online, and you have ways to communicate. With that, thank you so much for watching. I appreciate you. Have a great one, and remember, if we don't take care of each other, something went wrong.